We cannot afford more lockdowns, lest our economy bleeds to the point of irreversible damage. Naturally, we prioritize saving lives. Buhay muna bago ang lahat. Ibig sabihin, inuna natin yung gastos, yung pera natin sa pandemic. Kinuha ng lahat ng mga budget. Si Dominguez yan. Yun ang ginamit ninyo sa Bayanihan 1 and 2. Doon natin kinuha yung pera. We move quickly to safeguard the well-being of every Filipino through preventive and responsive health and safety measures and broad inclusive social amelioration programs or SAP. Thanks to the support of Congress, we launched the most extensive social protection program in our country's history with the Bayanihan passage of Bayanihan 1 and Bayanihan 2. Indeed, our national health system and the resilience which were tested to the health. Countless lessons we learned and continuously improvements put in place. Kahit anong crisis ay kaya malampasan kung tunay na may malasakit at bayanihan. I agree. At the early stages of the pandemic, our testing capacity was very limited. Recognizing the importance of conducting more tests to ensure early detection and timely isolation of confirmed COVID-19 cases, we ramped up our testing capacity. We now have more than 260 accredited laboratories nationwide, which is still capable of conducting at least 50,000 tests daily. All regions now can conduct their own COVID-19 tests. To take care of mild and asymptomatic cases, we established over 9,000 temporary treatment and monitoring facilities across the country, with a total bed capacity of more than 140,000, together with the local government and the private sector. We quickly established mega quarantine facilities that could accommodate more cases. Modular hospitals and quarantine facilities have also been established nationwide, especially in Metro Manila. For our severe COVID cases, our tireless health workers will continue to ensure that you are provided with the best care around the clock based on the latest development global best practices. Our health experts continue to actively participate in the search for safe and effective COVID-19 medicines. With the help of Congress, kita mo sa lahat, I never said, wala kang makikita that I developed, caused the construction of a bridge that is nowhere to be found today. Ako, sa inyo talaga, with the help of Congress, we passed 13 measures that establish the new and improved the capacity of existing hospitals around the country to provide quality care and services. Our people, especially amid the ongoing pandemic-19. This includes establishing new medical facilities in Mandaluyong City, Bacolod, and Davao Occidental, increasing bed capacities to existing health facilities. In Quezon City, Ilocos Sur, La Union, and Palawan, the upgrading of health facilities in that area to include Leyte. Currently, we have received over 30 million doses of COVID-19 vaccines. We expect to at least receive 36 million vaccines this month, and in August, we have inoculated more than 7 million Filipinos which have received the first dose, at least 17 million. Well, I think the landscape, the health landscape of the country continues to improve as we, with the continuous approval of COVID-19 vaccines, we are ready to boost further our daily vaccination rate. And I also encourage our local government units to hasten the rollout and strengthen the inoculation program. San Juan City, for one, have vaccinated 70% of their population in a month's time. Saludo ako sa inyo at kay Mayor Zamora. We cannot continue living in the shadow of this potent enemy, especially now that science and medicine has proven that it is possible to live, if not entirely defeat, this virus. The health and safety protocols we put in place have proven effective in slowing down the spread of virus. I implore our countrymen who are now in the list of sectors to be inoculated to get vaccinated now. And to those who received their first doses, please return for your second shot. I also ask for patience for those who are next in line to receive vaccine. More and more COVID-19 vaccines are arriving each week, and you will soon have your turn. Corollary to this, it is high time that clear and precise uniform protocol and guidelines are issued in anticipation of the vaccination of more Filipinos and the steady reopening of our society. Pagpasensyahan niyo ako, I beg your kind indulgence. But I have to talk about something which would affect us all. It seems that this government is too far away from the people. Yung serbisyo talaga na totoo. Nung isang araw nakita ko, I don't have to know what place was that. Ang mga tao nakapila. And they said that they were there at 4 o'clock. Lumalakas yung ulan, sa payong lang sila. So nanonood ako sa report because I listen to the report every morning. Makukuha mo sa mga radio station yan eh. So I was having breakfast. I was listening to their TV. At nakita ko yung mga tao nakapila doon, malakas ang ulan. Sabi ko, doon sa breakfast table, nagmura ako. Pero dito, good boy man ako kay may mga religious dyan. Baka. I just call on the National Task Force Against COVID-19 to see to it that this happens. The protection. We have spent enormous amounts of resources to build our capacities to overcome this pandemic. We cannot afford more lockdowns, lest our economy bleeds to the point of irreversible damage. Balitan ko, bakit mo papilahin? At sabi kasi doon, libre lahat na, wala nang So nagpuntahan yung mga tao, nagpila, kasi wala nang lista-lista. Pero sabi nung ito, alas 4 pa sila. Hindi lang ako pwedeng alam mo, sa totoo lang, hindi naman ako nagyayabang. I'm just an ordinary Filipino citizen. Just like you, I get hurt when people are nearly almost brutalized. Bakit hindi ka magkuha? It's rain time. Malakas ang monsoon, southwest monsoon, dumadaan talaga sa Pilipinas. Gamitin mo utak mo, you should look for a gym. At bigyan mo lahat ng tao ng number. Hanggang dito lang po. Hanggang dito lang tayo, balik kayo. Itong bukas, from 15 to 20, kayo na naman bukas. Bigyan mo lang card. Prepare a card where you can, the marshal will go around the queuing na, bakit mo, hindi ko maintindihan. Ano, this media? Hindi ko maintindihan, bakit gawain mo yan sa Pilipino? Yan ang tinatanong ko. Why do you have to do it to the Filipino? You can always, maghanap ka ng, there's always a gymnasium. Mga eskwelahan, walang klase ngayon. Bakit hindi mo gamitin doon? Bakit ka maghanap ng isang tarantado. Kaya lang ako, well, it is to my chagrin, because gusto kong lumabas. Itong PSG lang na ito ang, sabihin ko sa inyo, huwag kayong magpresidente. Wala talagang, sabihin ko, maliit ang sweldo. Wala ka. If you're not there really for mag-corrupt ka dyan, well, it would make you a billionaire overnight. But kung magtrabaho ka lang ng ganito, ako presidente, gusto kong lumabas doon, sabihin ko, hoy, bakit ganito to? Bakit ganon kayo ka-stupido? I mean, the Filipino does not deserve it. Even if they are not paying taxes. Because the theory of government is that all money belongs to the people. And the money is there. It belongs to all of us. And it should be used for public good. But what is the use of public good if you are not good and stupid? So, ganon ang mangyayari sa Pilipino. Today is my last State of the Nation address. But this is by no means my swan song. I shall never cease to implore Congress to pass vital and critical legislation, as well as to push the entire government to ensure nothing less than the full recovery and revitalization of our country. But to do this, it is necessary for us to first overcome the crippling fear, anxiety, and uncertainty that was caused by the threat of the COVID-19 virus. Well, I really do not know what to do. I have to listen to the task force. This is a group of people volunteering to be a collective advisor, or that would give you the advice collectively, we put it that way, na sila ang magsabi. And we're just waiting for the word. I am referring to Delta. It is rampaging now in Indonesia, Thailand, India, and many parts of Asia. And ang sabi doon sa the Western medicine says that it is far more aggressive and far more dangerous, and it can cause death easily than the COVID-19 original. So this is as good as any other time to say it. If says that it is really dangerous, you have to go back to lockdown. If there are many people in other parts of the world killing as many than Delta, if ever it will spread, we have it here now. I hope it will not go any further. But if something wrong happens, I'll have to be strict. And I have now my word that there will be, just like what happened in the early days. Kung ganun ang COVID, saan tayo pupunta? And if it requires a new vaccine, we do not have it yet. I don't know what, maybe we'll just have to pray for salvation. Sabihin natin, Diyos, we have done everything, but this time we are really put hard on these things that happen.